So Brad, in your expert opinion, how has the meanings of health changed over time?
Well, Stephen, prior to World War II, people often associated good health with being free from illness and disease.
Do you see this as a problem, Brad?
Yes, Stephen. Viewing health as merely an absence of illness or disease implies that many people would not be classified as healthy according to this definition. If, for example, a person was disabled, they would not be able to achieve good health based on this definition.
I heard that the World Health Organization devised a new definition for health. Is that correct, Brad?
Very good, Stephen, that is correct. In 1948, the World Health Organization defined health as a state of complete physical, social and emotional health. This was a large shift in thinking, as it was the first time that people started to recognize that a person's health was more than just physical.
That is most interesting, Brad. I have heard that health is comprised of different dimensions. Could you please explain what they are?
Well, Stephen, these days people recognize that health comprises the physical, social, mental and emotional, as well as the spiritual dimensions of health. We often refer to health as being multidimensional. Consideration should also be given to the notion that health be viewed as holistic.
What do you mean by holistic, Brad?
The term holistic means that health should be viewed as a whole, and it recognizes that health is made up of the physical, social, mental and spiritual dimensions, and that these dimensions are interrelated. Therefore, we must realize that one dimension can have an impact on the other dimensions of health. An advantage of viewing health holistically is that we begin to realize that just because a person's health may be reduced in one dimension of health does not imply that they cannot achieve good or optimal health.
Is there anything else that our viewers need to know about the concept of health, Brad?
Well, the final thing that people need to know about health, Stephen, is that health is both relative and dynamic. The term relative implies that our health is relative to other people's, therefore meaning that it is different and not the same. We need to remember that people experience different determinants that will affect their health. Also, health is dynamic, which suggests that it is changing. Therefore, our health status can change from day to day, year to year. This change is dependent on the various circumstances that can occur in our life, for example, sickness, injury, death of a loved one and so on.